Morning. How's everyone doing? Thank you, Leader Driskell. We wanted to welcome everyone here for our press conference. So, Leader Driskell, am I starting off?
Yes, go for it.
Okay. Good morning, everyone. As we gather, we just wanted to say a few words about the 6-week abortion ban, HB 743 and SB 870, termination of pregnancies that we have filed. Since the repeal of Roe versus Wade, women in Florida have watched hurdle after hurdle be placed on their health care, from our state to our federal institutions. They've been told they have to travel. They've been told they have to seek multiple doctors, and they've been told they've missed a deadline. 57% of Floridians this past election told us they do not stand for these rollbacks. 57% of Floridians do not stand for these intrusions into our personal lives. And 57% of Floridians do not like their health care in the hands of politicians. We are not politicians. We are public servants, and we hear the call of all women. Our laws punish women who do not have regular doctors. Our laws punish women who miscarry. And our laws punish women who are victims of violent crimes, rural women, Black women, Hispanic women, and poor women. Our current law has us in a time before science, in a time before empathy, and that's why we filed SB 870, because we're trying to bring laws back to modern times. Our law does not ban abortion. They ban safe, regulated abortion, and this will protect lives. Women are forced to bleed out, experience sepsis, to watch non-vital fetuses die, and to suffer consistently to uphold a bill written by men who will never go through this themselves. Today, we stand for those women, and we stand for 57% of Floridians who do not want this. We also stand for everyone who doesn't support this backwards law. Thank you, Leader Driskell.
Thank you, Senate Leader Pro Tem Davis, and good morning. So I have a core belief that's shared by a large majority of Floridians, in fact, an overwhelming majority of Floridians, and that is that decisions about abortion should be left to women in consultation with their doctors, their families, and their faith. Florida's near total abortion ban simply puts women's lives at risk, and it threatens to put doctors in jail just for providing the best care to their patients. This has resulted in devastating consequences for the health and lives of too many Floridians already, and we need to stop it immediately. A few extremist politicians should not be able to overrule a woman making a private medical decision or a doctor using their training and judgment to make the best choice for their patient. Now, we may not all agree about abortion, but I hope that we can agree that our healthcare professionals should be able to provide safe and reliable medical care to their patients without the fear of criminal prosecution. Simply stated, Floridians do not want Tallahassee politicians in their exam room as they talk to their doctors. The majority of voters, the overwhelming majority of voters, 57%, were in favor of ending government interference with abortions. If Amendment 4 had been a candidate, it would have been elected to office convincingly. It had widespread support from Republicans, Democrats, and independents who wanted to end Florida's extreme abortion ban and ensure that women were able to make these private medical care decisions for themselves. With Senate Bill 870, and I'll be filing the companion bill in the House a little bit later, we simply want to implement the will of the voters and repeal Florida's 6-week abortion ban. We call on our colleagues to listen to the people and to repeal this extreme and dangerous ban. Floridians deserve the right and the ability to make their own decisions on how, when, and if they have children. We owe this to everyone who voted in favor of Amendment 4. We owe this for Floridians past, present, and future, and to the women who lived before Roe and who fought for its protections, to the women who are terrified today about what a pregnancy might mean for their lives, and for all of the Floridians who are little girls right now and making sure that they have the same rights that their mothers and their grandmothers had. Now, please allow me to introduce a prime sponsor of the House bill, my colleague, Representative Rita Harris.
Thank you so much, Leader Driskell. Good morning, everybody. I just want to reiterate that Florida's abortion ban is dangerous, unnecessary, and unpopular because it forces politics into our personal, private lives, and it criminalizes doctors and stops them from providing the safest and most appropriate medical care. Decisions about abortion should be left to women in consultation with their doctors, doctors who take an oath in their patient's best interest. But Florida has banned abortion before many women even realize they are pregnant, with no workable exceptions for rape, incest, or the health of the woman. We know Floridians value freedom, and they don't want politicians making decisions about their health, their families, and their future. And we won't rest until everyone in our state is able to access a full range of reproductive health care, and that includes abortion. And that starts with ending Florida's abortion ban. And although Amendment 4 fell short of the supermajority necessary for passage, we will continue, and it barely fell short, we should add, we will continue to fight, legislatively to overturn the abortion ban rejected by the majority of Floridians. And as supporters of access to abortion, we are the majority, and we are absolutely not going anywhere. And so with that, I would like to, again, thank you all for being here. And I'd like to introduce a true champion of reproductive healthcare access. Always been fighting the fight for a very long time. We're happy to have her, my colleague, Representative Dr. Anna Eskamani.
Thank you so much, Representative Rita Harris and Leader Fentrice Driskell, and of course, Senator Tracie Davis. I am so humbled to be in the company of such phenomenal, fierce fighters and leaders and advocates for reproductive freedom here in the Sunshine State. We're going to cut to the chase here, y'all. The situation for the women of Florida is dire, despite the fact that nearly close to 60% of voters across the political spectrum said that they want to end the near total abortion ban. The state of Florida still maintains a dangerous policy that is deceptive, that disproportionately harms low-income, rural, and marginalized communities, criminalizes doctors, and it does criminalize not just women, but it also has the capacity, based on Florida's aid and abet laws, to criminalize anyone who helps someone end a pregnancy. In the face of federal policies and executive orders that are also taking away reproductive rights, shifting funding towards things like abstinence-only programs, and destroying basic safety nets, it becomes more important than ever that we listen to the will of the voters here in Florida and repeal the state's near total abortion ban. As someone who worked at Planned Parenthood before I ran for office and has been, of course, someone of also a reproductive age who sought reproductive care from Planned Parenthood, like many of us and 1 in 5 American women, we know at a personal level how important this is. The majority of us, if we become pregnant, will not realize that at 6 weeks. And so the current state of affairs in Florida forces us to make very difficult decisions because of political interference. And as you heard from my colleagues, we believe firmly, as does the majority of Floridians, that decisions about one's pregnancy are personal and private and should remain between that person, their family, their doctor, their faith, and not politicians, period. And it's so important for us to also just examine the landscape. The rate of abortion in Florida has declined due to this law, but the rate nationally has not declined, because the only thing that's happening is now women and abortion seekers are being forced to travel hundreds of miles to access care. For individuals who have healthcare risks, if a doctor is not comfortable diagnosing that, they've also been forced to travel to access care. And the law itself is vague, but there is confusion over when a doctor is allowed to provide care, life-saving care, whether they're not. And there has yet to be an effort from the legislature to provide any clarity to these often tragic and difficult situations. We believe in a state where you have the freedom to decide when or when not to start a family, and the majority of Floridians have spoken and agree with us. And it's time for the legislature to listen and end this dangerous abortion ban once and for all. And with that, we're going to step back and see what questions folks have. And you're welcome to drop questions in the chat, or I'm sure Jackson can help coordinate Q&A with the mic as well.
That's perfect. Yes, if you have questions, please put them in the chat or feel free to take yourself off mute. We've got the first one from Liv Caputo. Thank you, Liv. What are, if any, the differences between this bill and Amendment 4? And as a follow-up, what gives you hope that this repeal will pass, considering the Republican supermajority has shown no sign of letting up on abortion laws? Thank you for that. The bill is very simple in terms of repealing the 6-week abortion ban, which would put us back in the state that we were in before Roe versus Wade was overturned. So what gives us hope that this bill will pass? I'll be honest, we understand vote counts, right? Like I understand the obvious math, which is that the Democrats are in the minority, and unfortunately, we don't have the numbers that we need to pass this on our own. So please understand that this is providing an opportunity for a conversation. And we are inviting, maybe I should say, our Republican colleagues to have this very important conversation, because the voters certainly wanted to have this conversation this past election cycle. And we know, as we've mentioned on this call, that over 57% or roughly 57% of Florida voters voted in favor of this. That's a really big deal. In any other state that had a regular 50% threshold, Amendment 4 would have passed. And so this is something that is on voters' minds. It is important to them. It's a conversation that needs to be had. And you never know where those conversations can lead. But it's important for us from a policy perspective to make sure that this is front and center of this legislative session.
Let's go to
Hi.
Todd next.
Yeah, Leader, have you considered partnering with a Republican, for instance, like the former Democrat Susan Valdez, since you know where she stands on issues like these? Have you considered crossing the aisle to try to get Republican support on this issue?
Thank you for that question, Ty. And in this legislative process, honestly, in order to get anything done, we have to be able to build consensus with our Republican colleagues. With the filing of these bills, it sort of opens up the opportunity to start having those conversations. I wouldn't presume to know actually what any of my Republican colleagues think about this, and including representatives who may have changed some of their core beliefs recently, but those are conversations certainly that need to be had. You know, my concern, and I think the concerns for Rep. Escamani and Senator Davis and Representative Harris, is just making sure that the people's voices are heard, and that necessarily will mean working across the aisle to have this conversation.
And just as a quick reminder too, several Republicans did vote no on the 6-week abortion ban on the House floor. And of course, the 57% of voters that said yes on Amendment 4 are individuals who voted in very diverse ways, including Trump voters. And so this is an issue that has always transcended party lines, despite the attitude of the legislature, the extreme attitude of the legislature that's never been reflective of everyday Floridians.
I can see that Yvette Sanchez put a question in the chat. Do you think President Trump signing the executive order to expand access to IVF, making it more affordable for Americans, will have any sway? I mean, honestly, what we've seen from this legislature and from this governor is that they are absolutely allegiant to Donald Trump, and will basically do anything that he says or that he wants, carry out his will. You know, we certainly saw that with the special sessions on immigration. So perhaps this executive order might provide the Republicans with the permission structure to start having some conversations around this. But please understand, we don't know all the details of that executive order. We need to see what happens, and understand also that IVF is important, but it doesn't cover the issue that we're talking about here today. IVF is one part of the conversation around family planning, but really families need to be able to have women need to have the assurances that they need. They can get the health care, and abortion is health care. And we also need to be protecting our doctors because there's a lot of confusion amongst our medical professionals about what they can do. You know, we hear stories about women who are miscarrying, women who are being told to go home and just deal with that miscarriage and have to bleed out. Like, this is just not sustainable in terms of wanting to have a state where people can be healthy and make these very private decisions of heart and home without the interference of politicians. And so IVF is important, but it does not cover everything that we're trying to accomplish with this repeal today.
I just want to add that it is having an impact on our medical providers. As was mentioned, I spoke with a medical provider over the summer who is an OBGYN, and he also practices in the state of Maryland, where they do not have a restrictive ban on abortion. And he said his healthcare practice there, just in regular everyday OBGYN setting, is so much different than it is here, because he doesn't have to question if what he's about to do is legal or illegal and the impact it's going to have on his livelihood overall. And I just wanted to add that story because I think it's really powerful in the context of what we're talking about today.
Thank you,
Kate,
Harris.
I believe Kate Payne has a question. Kate, you're next.
Yeah, we've seen in other states where abortion restrictions are in place, some patients dying as a result of not getting care. I'm curious, as far as Florida's Maternal Mortality Review Commission, if you all have gotten any updated information for them. The last time I checked, they were 2 or 3 years behind in reviewing cases. So are you expecting any information to come out of that review process?
I can help grab that one, leader, if you'd like me to.
Thank you.
So you are correct, Kate, that the data is delayed, and I have concerns that it's being intentionally delayed because it's not positive. We've seen across the country that states that ban abortion have worse maternal mortality rates. Again, abortion is healthcare, and it's essential that a state provides a full range of reproductive healthcare options, from abortion care to contraception to IVF. And so I am concerned that when the data becomes available, it's not going to be positive. And that is one reason why the data is lagging. Of course, this has also been a executive office of the governor that likes to massage statistics and to kind of handpick stats that they prefer to share versus others. So that accountability of data is going to be very important for all of us. And I know our team will be aggressive in getting to the most accurate and updated data that we have. But just looking at the pattern in other states, it's rarely going to be a positive result.
Thank you for that. And I'll add the maternal mortality rates is something that we're very concerned about as well, Kate. Last session, I was honored to get into the budget funding for a study, particularly of the Medicaid population, which we know is a population that contributes significantly to the new births that we have in the state, and trying to understand more about what's happening with their health in pregnancy. And to me, considering the lack of abortion access is something important for that new data. So as Rep. Escamani said, we'll be pushing to get more of that so we can have a clearer picture of how this is impacting our state. I think the next question is from Forrest Saunders, who says the House Speaker said he wanted members to drive the bills this legislative session and become more unscripted. Do those words feel hollow or honest as March 4th approaches, as the start of session, as a session starts? Forrest, honestly, it's unknown. So few bills have moved, it's impossible to say yet. And that's not just bills on the Democratic side, bills on the Republican side also have not moved because we've been so obsessed, the Republicans in the legislature have been so obsessed with doing Donald Trump's bidding on immigration. So we have yet to see how that's going to happen. I know this week there's at least some Democrats who have their bills moving. So we'll see how that goes as we get into legislative session. I think the next question is from Liv. Another question on the topic of maternal mortality data. Do you think those potential numbers could be related to Florida's drastic decline in abortions over the past year? I don't know. I don't know that that's how the abortion ban is going to impact those numbers. I don't know. I think the data has lagged for longer than the past year too, right, Rep. Escamani? So we kind of need a clearer picture of the data, I think, to understand.
Yeah, it's hard for me with my PhD hat on. I want to be careful about causation versus correlation. But obviously, just based on data from other states, and of course, research by institutions like Tulane University and Johns Hopkins and others, that states with restrictive abortion laws have higher rates of maternal mortality. And of course, those inequities are disproportionately impacting Black, Indigenous, and other historically neglected communities. Important to, of course, remember that abortion is incredibly safe pregnancy has risks. Every pregnancy is incredibly unique. And when we tie the hands of doctors, the care they're able to provide, it, of course, impacts patients in negative ways. It forces patients to make tough decisions. It forces them to travel far distances. And in one study by the University of Colorado, in fact, estimated that a federal abortion ban would increase maternal deaths by 24%. And that, of course, speculating if there was a federal abortion ban. But these are just stats that speak for themselves.
Thank you. Okay, seeing no additional questions in the chat.
Oh, I have a question.
Okay, Jackie.
Hi, sorry. So seeing the decrease in abortions that ACA is reporting, and then also seeing data from other states that are reporting 0 abortions, are you concerned that this reporting of abortions is not being accurate in the sense that we had those emergency rules saying that certain procedures, such as when someone's water breaks prematurely, don't count as abortions?
I am concerned about that. To echo the comments of my colleague, I'm concerned that the majority is playing games with the data to try to tell the story that they want to tell, that Florida is a state where abortions are not happening. We know that is not true. We know that women are being pushed to very extreme circumstances where they're being denied health care because the doctors are afraid and want to abide by the law and don't want to have to lose their jobs or face criminal prosecution. And so there is concerns. I mean, there are concerns. We do want to get the data that is available, but it is quite possible that that data is being manipulated, which brings us to why we even filed this bill, these pieces of legislation in the first place, which is that the 6-week abortion ban is causing confusion. It's causing harm to women. It's causing doctors to not be able to practice as they were trained to do. And it's absolutely resulting in unhealthy outcomes for Florida's families. We believe that these are private decisions, very personal and intimate decisions of heart and home, and politicians have no place in them. And we really need to get back to the place where we can roll back this ban.
And if I may just provide an additional data point for consideration of how traditional rates of abortion are not going to accurately depict what is happening. There is no doubt in my mind that even in states like Florida, where this is technically prohibited, that individuals who wish to end their pregnancies are ordering abortion medication online and ending their pregnancies in the privacy of their own homes with no reporting. And I think it's very important for the press to understand that. But the women who are doing this are taking a risk. Not only does it break the law when it comes to not accessing abortion medication without a doctor being present, which is what Florida requires, accessing abortion without 24-hour delay, which is what Florida requires. Also, just the risk of potentially ordering medication from a unverified source, which I will say there are very trustworthy organizations under the banner of Plan C, pills.org, which is helping women navigate the landscape state by state and ordering abortion pills online. You also have an organization called If, When, How, which is providing pro bono legal aid support. They have a reproductive legal helpline, and they are over flooded with calls. And of course, you have abortion funds, which are nonprofit, privately funded organizations raising money to help with the travel and lodging and other types of travel costs that women are incurring. But the reality is that the rate of abortion that you're tracking through something like ACA is just not going to capture the full picture here. And it's really unsettling that you're going to have individuals work to safely end their pregnancies on their own. But then if something were to take place where they have unusual bleeding and clotting and may need to seek emergency care, they may actually avoid doing so for fear of some sort of prosecution later, as we've seen in other states like Texas and Nebraska and so forth. So I think it's important to kind of broaden the scope here a little bit. This is unprecedented environment, but the reality is that if you wish to end your pregnancy, you will find a way to end your pregnancy, but you may be turning towards unsafe means to do so, or politically opposed decision making that is criminalized by the state. So it's important to be mindful of that too.
One more thing, Leader, for the upcoming bills in the Senate chamber and the House, are we talking about up until viability? And then I'll let you answer that one first, and then I have a follow-up. Just so people will know, are we talking about up to viability when it comes to what you're calling for? Excuse me.
Thank you. So again, this is a repealer bill that would take us back to the state that things were in pre the overturning of Roe versus Wade. I wanted to mention too that there was a bill filed earlier, but on the House side, on my side, that had a drafting error. So that bill has been withdrawn. We're going to fix that error and get it refiled. So I think, Anna, thank you. You're so good, Rep. Escamani, in the chat, where she mentioned that Florida had a viability ban before Roe versus Wade was overturned. So yes, this is a viability restriction. We're going to be able to take one more question, and then we're going to have to close out the press conference. Yvette Sanchez asks, with all of the statistics that prove abortion to be beneficial and is healthcare, what do you think could be the argument that sways the other side of the aisle? Thanks, Yvette. I honestly think that with policy discussions, I'm not so confident that it's that my colleagues on the other side of the aisle aren't aware of the policy implications. But to me, what seems to move the needle are stories. And I don't know that my colleagues understand the impact that this 6-week ban has been having on women across our state. So we're hopeful that with filing this legislation to repeal the ban, that we'll be able to spark those conversations and perhaps share some of the stories so that our colleagues can understand how this has impacted Florida's women over the past year or so. I mean, there are women who are finding out that they'd be forced to carry their baby, even though the baby has significant healthcare hurdles to overcome. And women are being forced to carry that to pregnancy and then to have to hold their baby and watch it die. I mean, there are women who are bleeding out from miscarriages. This is a really, really drastic and dire situation. And we need to continue to uplift these stories so that our colleagues can come face to face with the consequences of the policy that they have passed. And I just wanted to uplift one additional point, which Rep. Escamani made. The opposition to the 6-week abortion ban was bipartisan. The opposition included Republicans and Democrats, which is far more reflective of the coalition that we know, the 57% who voted in favor of Amendment 4 and basically rolling back the 6-week abortion ban. And so that's a conversation that we're putting front and square and that we will continue to have this legislative session. Rep. Escamani or Rep. Harris, do you have anything to add before we close out?
Yes, I wanted to add something in regards to Yvette's question. And I think it's also really important that we highlight the fact that bans on abortion impact intended pregnancies too, and they impact the women that are carrying them. And one story, if I could uplift, a friend of mine, her daughter was pregnant and she had to have an induction because of edema, and she had a scheduled induction. And when she went to go in, she was sent home because it wasn't that they didn't have enough beds, they didn't have enough providers. Because we are already dealing with a lack of providers. And then when you put obstacles in the way of people doing their jobs, what happens is they leave and they go places where it's much easier to do their job. So I think it's really important that we also understand that when you ban abortion and you make it difficult for medical providers to navigate these spaces and understand, well, is this what I'm doing is legal? Is this what I'm doing not legal? We are also impacting people who have intended pregnancies. We're impacting them if something goes wrong, and we're also impacting them if nothing goes wrong. And so we have to be mindful of that. And it's one of the reasons why access to reproductive health care like abortion is so necessary for the health of women in general, whether they are pregnant or not.
Thank you, Rep. Harris. Well, thank you all for joining us today. The link has been made available in the chat. If you have any additional questions, please reach out to our communications director in the House Democratic Office, Jackson Peel, or please reach out to Planned Parenthood, who I believe their contact was included on the media availability press release. Thanks.